Okay, welcome everybody. This is our first meeting of 2024. Um, so as you all know, COVID is raging at the moment, very, very high figures across the country. Hospitals are inundated. Um, Big issue for us is that the media continues, of course, to downplay it. But we're now faced with a number of questions about what we should do going forward this year. COVID Action is an organization that's led by its supporters, members. So we're gathered here tonight to talk about what we should do going forward. Now we're going to divide the meeting into two parts, really. First, we're going to have Dr. Jonathan Fluxman from Doctors in Unite. We'll be saying a few words about a proposed conference around COVID, which a number of COVID organizations are planning to have. And then we'll have some contributions on that. And then about half an hour or so later, we'll have a more general discussion about the sort of issues and campaigns which you think we should all take up going forward this year. So first of all, I'd like to welcome Jonathan Fluxman. So over to you, Jonathan.
Thanks very much, Joseph, and to Joan and to COVID Action for the invitation. It's really nice joining you again, and to see lots of familiar faces and lots of new faces and names in the audience. So great to be with you. Yeah, okay. So the COVID conference. I mean, I think many of us who've been campaigning for a while around COVID have really simultaneously come to the same kind of conclusion, if you like, or have the same idea that we have to get better organized if we're going to achieve change. There's been lots and lots of great work done in many different areas, in schools, in healthcare, in the workplace. The COVID inquiries is obviously been going on, and lots of people involved in that and everything. But what is striking is that we are all working separately from each other. I wouldn't say in isolation, but certainly separately from each other. And I think there's a real need to come together as a movement and work together, share resources, um, you know, from the most basic things like who has good information about how to set up air filter units in the classroom in schools. Who's done work on that? Who knows about the infection control guidelines in hospitals? Because I've been told by my local PALS service at my local trust that, oh, they're following the guidelines. Well, we all know the guidelines are crap, but do we have information to challenge that? Where can I find that? Who can I talk to? And so on and so forth across the board. So there's information sharing, but also I think a need to unite around a sort of common strategy and idea, and if you like, an ethos, a kind of demand that we can all sign up to. You know, we demand the right to breathe clean air. We demand the right to safe healthcare. Our children have a right to safe education. The schools have gone back this week. As Joseph has just said, COVID is absolutely rampant at the moment, along with flu and other viruses. And you know, the position we take, obviously, is not because there are lots of other viruses, therefore we give up on COVID and give up on everything. No, we want protection against all of them. But we need to articulate a clear vision and a clear strategy. And that's also one of the main sort of drivers behind this conference. So there's been a conference committee meeting for the last 2 or 3 months, probably 3 months, I think. And we made good progress. There's been a lot of preparatory work that's needed to be done. But we now have a name, which I think I'm at liberty to share, which is Together Against COVID, time to organize, exclamation mark, or time to get organized. I can't quite remember the exact word, but to convey the message that I'm just talking about now, that we must come together. And I would appeal to all of you who are on this call tonight. Please do try and support it, take part, do what you can to get involved in the area that you're interested in. And we don't restrict, we're not going to restrict people's involvement to only certain people and experts in the field and so on. What's been so illuminating doing campaigning work over COVID over the last few years is that everybody has got something to offer. Whether you're good at, getting petitions going and writing to your MP, or you like printing off leaflets and placards and going on demonstrations outside. The COVID inquiry, for example, which some of us have done. Or you want to hand out masks outside theatres, and there was a recent action about that, and so on and so forth. There are a myriad of things that we can do. We need skills like people who are graphic artists, people who are good at social media, people who can run Zoom meetings. All the things that are behind the scenes in terms of organizing meetings. I should say that the conference will be online, so it's not going to be an in-person event for the first time. And that takes me to another point I want to make and emphasize, that this conference is not a one-off event. It is the start of a process. It's the start of a process bringing us together to campaign from here onwards, because we know that the forces ranged against us are many and they are powerful. And by that, I mean government and all the institutions which we have depended upon to keep us safe, which have failed comprehensively to do so. And I can't think of one institution, well, there are probably a few exceptions, but the great majority of institutions in our society, unfortunately, have caved in, have remained silent, or just gone along with the minimizing and gaslighting agenda that the government is so hell-bent on pursuing. So it's down to us. It's down to you and me and ordinary people like us. But what's great about this work is that there are actually lots and lots of people doing it. And there are lots of committed people who feel very strongly about it, who have been doing work and are now willing to come together and work on this. Just looking at the number of people who've come to this meeting tonight, there's clearly an appetite to do this. So what I would say to you all is, please get in touch with us. Sorry, we should have actually covered this just before the meeting, Joseph and Joan, but if people could perhaps email into COVID Action or something like that, perhaps you can say, Joseph, at the end who their people should contact. But please do get in touch with us. Tell us what you'd like to do, which areas you're interested in. And the sorts of things we have in mind at the moment are, number one, schools. Number two, healthcare. Number three, the workplace. Number four, the COVID inquiry. And then a whole range of other things, perhaps. And one important thing which we were talking about at a meeting I've just come from was the need to provide and support counseling, stroke therapy with counselors and therapists who are COVID aware. Because I'm sure you've all heard stories of people who have been traumatized by COVID in a whole variety of ways. For example, just being left exposed as a healthcare worker in the workplace, having no protection, or just being ignored and gaslighted about your kids not being at risk at schools and things like that, or having got COVID and long COVID and got sick and been very ill and so on and so forth. So there is a very big need for people to receive support by professionals, by experts, by by people who are skilled at counseling, but who understand what's going on with COVID and don't buy into the gaslighting and say, well, actually, maybe you're anxious about this. And that is such a pernicious message. And we really need to knock that on the head. So if we are going to organize supports like that, and that is an idea that has been floated for the conference as well. Now, all of these areas, and that's not to say that what the areas that I've listed or just mentioned are exhaustive. No, if you have other ideas, what you think it would be good to cover in a conference, please say so. And if that is shared by lots of people, we will try and organize around that, put on a workshop, and so on and so forth. So let me not go on for too long, just to end by saying that the format of the conference will probably be something along the following lines. We haven't quite agreed on it just yet, but we will have a plenary session, and we hope to invite some very well-known and recognized experts, both to hear from them, but also to draw people in. Then there will be a series of workshops run in parallel, and we may need to repeat them because lots of people may want to attend more than one. You know, and if you are a healthcare worker, you may want to go to the healthcare worker one, and you also may want to go to the schools one because you've got kids going to primary school. So there will be overlaps in these. So there'll be several workshops, and we want to also, in the workshops, discuss this declaration of rights or principles that I've mentioned. So we want people to be able to have input into it, and not for us to just sort of publish a document and ask you to sign up to it. No, that's not the way we want to do things. We want to make this participatory, to give everybody an opportunity to contribute, to put their ideas in, and say, actually, in schools, what I think is really important is the way that my kids have been, discouraged from masking and keeping safe. Or I've been referred to social services or threatened with that. And I think it's really important that we challenge that and confront that and demand that schools are not allowed to do that. So we want people's input into this Declaration of Rights and demands as well. And for the workshops not to be simply coming together and talking on that day, but to actively look to set up a group or a structure that will take the work forward. Now, we need to be careful here not to duplicate what already exists. And that's why we really want to involve as many people who are active in the COVID arena to come along, to share what they're doing, and to say, well, actually, I'm involved in this group and we're already doing that. So we don't really need to do that, or come and join us. We've got this and we'd be happy to take on board the other things that people are speaking about. So the workshops will have those two aims, and to agree what. So if for example, you're in the schools workshop, we'll talk about, say, the practicalities of getting air filtration into every classroom, but we'll also talk about the Declaration of Rights as it applies to schools. And for the workshop to sign that off, if you like, make contributions, get it agreed, and so on, and then feed that back at a plenary session. And we'll have that at the end of the conference, again, hopefully with somebody who will be a draw for people to attend and so on. So it will be bringing together activists, people involved in campaigning, experts, all together. And we don't want to restrict this to simply medical experts. We want the aerosol engineers, aerosol scientists, the ventilation engineers, the air hygienists, and so on and so forth, so that we have a multidisciplinary approach to COVID and prevention measures. One of the biggest problems of the government's approach is that it has been almost entirely based around doctors, epidemiologists, and the biomedical sciences. And we know very well by now we are not going to stop this pandemic without the engineers not only being involved but leading. And engineers have been the people historically who have stopped pandemics in the past. It hasn't been doctors. And we know from the way infectious diseases see the pandemic and see the world that they are now actively obstructing mitigations and so on because they don't accept airborne transmission, for example, in healthcare.